thing about it is seeing that beautiful little baby in the arms of its parents, and if they've got any brothers or sisters as well, and just seeing, I think for me it's going from seeing a family generating and becoming a family. It's just beautiful, it's lovely. Yeah, there's nothing else like it, to be honest. And the smell of the baby, sorry. They smell gorgeous. They do. So you can go and see the woman at home or in clinic, and that's antenatally, so before the baby's born. So you're looking after the woman and making sure that she's eating well, she's healthy, and that the baby's growing. And if they've got any problems, you refer them to the doctors at the hospital. Then when the woman's in labour, you can have a home birth, and the community midwife goes to look after them at home, otherwise go to hospital if they've got any complications. But you can have, water births, lots of different things, quite exciting really. When the baby's born, the community midwife would go and see them at home, and you do the baby's weight, do the baby's measurements, make sure they're feeding properly, and make sure the woman's doing well as well after the baby's arrived. There are a number of options of becoming a midwife. I chose a more traditional route. I did my nurse training first, and very soon into my nurse training I realised I wanted to be a midwife. So I did my maternity placement and absolutely loved it. I saw a baby being born and I was hooked. So I did my an 18-month extension. But the more traditional route now is a degree course. So it's a three-year degree course, and you do that after you've done your A-levels. I think the challenge is it takes quite a lot from you as a person sometimes, because you go from those lovely happy occasions to sometimes things aren't going as well as the family expected or wanted. So it's going from seeing one family and being able to deliver them good news, but perhaps delivering not so good news from the family, and being able to cope with that you need to be quite resilient, I think, to be able to cope with those kind of days. That can be quite difficult, and it can be quite emotionally draining, and you get other days where you can be quite physically drained. You non-stop, you're going from one patient to the next, whether you're in community or in the hospital. So you do long shifts, night shifts. Those are the downside of it. The upside of that is you are part of a team, and as midwives we're really good at supporting each other and encouraging each other all the way through, and that is something that's really valuable. I think if you can demonstrate that you're a patient person, a tolerant person, and somebody who can rise to a challenge, however you've done that. Some people are good at teamwork in sports, and those kind of things are really good if you're looking at going for interviews. You can work well as part of a team. I think you looking at whether or not you like working with children and families, that's a really good asset. So if you've had experience with babysitting, childcare, so you've been involved in family care, things like being a nanny beforehand can really help you getting into with that experience. Healthcare, work in a hospital, the understanding of how the NHS works is quite a good thing as well. And generally things around women's issues, those kind of subjects and skills, psychology and the sociology type things can definitely help. One of my students used to call me Chris the midwife, and all my card says Chris the midwife. It doesn't just say Chris, and it just becomes who you are.